Hello everyone, welcome again in GSPP YouTube channel. Today's we have the topic anxiety suppression disorder. So first we have the introduction. Anxiety disorder is blanket term covering several different form of the abnormal pathological anxiety, fear, phobias and nervous condition that are described as an irrational or illogical worry that is not based on fact. Okay, so this is the anxiety disorder is blanket term covering several different, it is a blanket term covering several different form of abnormal, it is covering the several different form of the abnormal pathological anxiety, fear, phobias and nervous condition that are described as an irrational or illogical worry that is not based on the fact. The term anxiety disorder can cover a range of severities. Okay, the term anxiety disorder can cover a range of severities from general social anxieties to panic disorder. Okay, so it under this it term anxiety disorder can cover a range of severities, it cover a range of severities from the general social anxieties to panic disorder, right? From general social anxieties to the panic disorder. The anxiety disorder differ from the another in the type of object or situation that induce fear, anxiety or avoidance behavior and the associated cognitive ideation. Okay, so the anxiety disorder differ from the another in the types. The anxiety disorder it is different from the another in the types of object or situation, it is different from the another types of object or situation that induce fear, anxiety or avoidance behavior and the associated cognitive ideation. Correct. So the anxiety disorder it is the different from the another in the types of object or situation that induce fear, anxiety, avoidance behavior, and the associated cognitive ideation. Hope you got it. So, shall we move on? Separation anxiety disorder. Now we are talk about the separation anxiety disorder. Separation anxiety disorder (SAD) is a psychological condition in which an individual has excessive anxiety regarding separation from home or from people to whom the individual has a strong emotional attachment. Okay, separation anxiety disorder at SAD is a psychological condition in which individual has excessive anxiety regarding separation from home. People have may experience excessive anxiety regarding separation from the home, from the people whom the individual has a strong emotional attachment, right? तो इसमें क्या होता है, जो भी इंडिविजुअल है वो एंजाइटी को एक्सपीरियंस करता है, इसमें एक्सेसिव एंजाइटी को फील करता है घर से सेपरेट होने पर या ऐसा पर्सन से सेपरेट होने पर जिससे उसका इमोशनल बॉन्डिंग, इमोशनल अटैचमेंट अच्छा था, जब उससे वो अलग होता है स्ट्रॉन्ग इमोशनल अटैचमेंट वाले पर्सन से, तब उसे एक एंजाइटी डिसऑर्डर या एंजाइटी होती है जिसको बोलते हैं सेपरेशन एंजाइटी डिसऑर्डर। प्रेजेंट इन ऑल एज ग्रुप, ये जो है वो सभी एज ग्रुप में हमको देखने को मिलती है। अडल्ट सेपरेशन एंजाइटी इज नाउ बिलीव टू बी इवन मोर कॉमन देन द चाइल्डहुड सेपरेशन एंजाइटी। ओके, नाउअडेज अडल्ट सेपरेशन एंजाइटी इज नाउ बिलीव टू बी इवन मोर। हाँ, so SAD present in the all age group. It may be seen in all age group. Adult separation anxiety is now believed to be even more common. Okay, ऐसा माना जाता है कि जो adult anxiety disorder है it is the more common than the childhood separation. फर्स्ट डे ऑफ स्कूल जब हम जाते हैं, जस्ट इट इज द फनी इमेज, यू नो। सो फर्स्ट डे स्कूल जब हम जाते हैं, जब मम्मी हमको पकड़ पकड़ के स्कूल लेके जाती है, वैन में, बस में, स्कूल में छोड़ के आती है, हमको फियर होता है मदर से हमारे सेपरेट होने का। और इट द टाइम ऑफ जब इस कॉलेज का हमारा फर्स्ट डे होता है, सीनियर कॉलेज में जब हम जाते हैं ग्रेजुएशन करने के लिए, एट दैट टाइम हमको मदर जब कॉलेज में छोड़ के आती है तो मदर से अलग होने का हमको डर होता है, राइट? तो इट इज़ द डिफरेंट अकॉर्डिंग टू एज, ये हमारा डिफरेंट डिफरेंट हो सकता है। तो इस तरीके से इसमें हमारा बच्चा स्कूल नहीं जाता है, जब स्कूल से मदर जब कॉलेज हॉस्टल में छोड़ के आती है तो मम्मी को बच्चा रोकता है, राइट। तो इस तरीके से ये डिफरेंट डिफरेंट अकॉर्डिंग टू टाइम सेपरेशन एंजाइटी डिसऑर्डर डिफरेंट हो सकता है। सेपरेशन एंजाइटी डिसऑर्डर में कुछ हमारे सिम्टम्स इंक्लूड होते हैं, जैसे द स्कूल रिफ्यूजल बिहेवियर, स्कूल जाने से अपने अपने आप को रिफ्यूज करना, स्कूल नहीं जाना। फिजिकल सिम्टम्स सच एज हेडेक होना एंड स्टोमक एक होना, particularly when then occur persistently in the anticipation of the separation from the parents। जब पेरेंट्स से सेपरेट होते हैं उस समय पर हमारा एंटिसिपेशन होना, particularly एंड स्टोमक एक होना, हेडेक होना, दिस इज द फिजिकल सिम्टम। स्लीप आपका डिस्टर्बेंस होना, नाइटमेयर्स होना, रिफ्यूजल टू गेट स्लीप, रिफ्यूजल टू स्लीप ओवर। ओके, सो दिस इज द सिम्टम्स आपको हो सकते हैं। एंड नाइटमेयर अबाउट द पेरेंट बीइंग गॉन और लिविंग, नाइटमेयर होना अबाउट द पेरेंट्स जब चले जाते हैं, लीव करते समय। एक्सेसिव वरी होना अबाउट फैमिली मेंबर्स सेफ्टी of safety or the child's own safety, excessive worry or panic when the anticipating or experiencing a separation from the home, refusal to go to school or other activities away from the home। Got it? So studies show that children suffering from this separation anxiety are much more likely to have ADHD, bipolar disorder, panic disorder, and other later in the life। Okay, तो स्टडी ऐसे बताती है, स्टडी शो करती है कि दैट चिल्ड्रन सफरिंग फ्रॉम दिस सेपरेशन एंजाइटी आर दी मच मोर, ज़्यादा मच मोर एक्सपीरियंस करते हैं एंड मच मोर लाइकली टू एज कंपेरिजन टू ADHD, bipolar disorder, panic disorder and अदर लेटर इन दी लाइफ तक, राइट। अब इसका इटियोलॉजी क्या हो सकता है, तो इट इज़ द नॉर्मल फ्रॉम द अबाउट एज 7 मंथ थ्रू द प्री स्कूल। प्री स्कूल के जो 7 मंथ है उस समय पर मोर कॉमन होता है। सेपरेशन एंजाइटी ऑफन डेवलप आफ्टर द सिग्निफिकेंट स्ट्रेस और ट्रॉमा इन द चाइल्ड्स लाइफ सच एज। अब सेपरेशन एंजाइटी ऑफन डेवलप आफ्टर अ सिग्निफिकेंट स्ट्रेस, सेपरेशन एंजाइटी ऑफन डेवलप आफ्टर सिग्निफिकेंट स्ट्रेस और ट्रॉमा की वजह से ये हो सकता है ऑन द चाइल्ड्स लाइफ सच एज स्टे इन द हॉस्पिटल, हॉस्पिटल में स्टे होने की वजह से, द डेथ ऑफ लव वन की वजह से, डेथ ऑफ लव वन होने की वजह से, चेंज इन द इन्वायरमेंट, इन्वायरमेंट में कोई भी चेंजेस होने की वजह से। आई कैन नॉट थिंक ऑफ एनी नीड इन द चाइल्डहुड एज स्ट्रॉन्ग एज द नीड फॉर द फादर्स प्रोटेक्शन। ओके, so this is the etiology। SAD in the children में the heritable, children में ये आपकी heritable हो सकती है। There are the cultural variation in the degree to which it is considered desirable to the tolerate separation। Okay, so there are the cultural variation, cultural आपका variation हो सकता है in the degree to which and it is considered desirable to tolerate separation। SCD decrease in the prevalence from childhood through SAD is decrease in the prevalence from childhood through adolescence and adulthood and is the most prevalent anxiety disorder in the children younger than 12 year। Okay, so at SAD decrease in the prevalence इसका decrease होना SAD का from the childhood through adolescence, childhood से आप adolescence में, adulthood and is the most prevalent anxiety होना adulthood में and in children younger than the 12 year। Okay, next is the diagnostic criteria DSM-5 are developmentally inappropriate and the excessive fear or anxiety concerning separation from those to whom the individual is attached as evidenced by at least 3 or the following: recurrent excessive distress when anticipating or experiencing separation from home or from major attachment figure। Okay, so it is the recurrent excessive distress होना when the anticipating or experiencing separation from the home or from the major attachment figure, persistent and excessive worry होना about losing major attachment figure or about possible harm to them, such as illness, injury, disaster, or death. Third one is the persistent and excessive worry about experiencing an upward event, example, getting lost, being kidnapped, having an accident, becoming ill, that cause separation from major attachment figure. Fourth one is the persistent reluctance or refusal to get to go out away from home to school, to work, or to elsewhere because of fear of the separation. Persistent and excessive fear of persistent fear of or reluctance about being alone or without mature attachment figure at the home or in the setting. Persistent reluctance or refusal to the sleep away from home or to go to the sleep without being near a major attachment figure. Repetitive nightmares involving the theme of separation. So it is come under the diagnosis criteria DSM-5, a developmental inappropriate and excessive fear or the anxiety. This is the come under anxiety disorder. Would it be the fear or avoidance is persistent, lasting at the least 4 weeks in the children and adolescents and typically 6 months or more adult. The disturbance causes clinically significant distress or impairment in social, academic, occupational, or other important areas of the functioning. Would it? Dear disturbance is not better explained by another mental disorder such as refusing to leave home because of excessive resistance to change in autism spectrum disorder, delusion or hallucination concerning separation in the psychotic disorder, refusal to outside without a trusted companion in agoraphobia, worries about ill health or other harm, we falling significant other in the generalized anxiety disorder or concern about having an illness anxiety disorder. Good. Now we are talk about the management. Cognitive behavioral psychotherapy is the primary type of treatment used for SAD for older children who have not outgrown separation anxiety within the normal developmental timetable or who have tri- regressed to it under the stress. Effective treatment may include anti-anxiety medication and changes in the parenting techniques, counseling for the parents and child. Treatment for severe cases may include family education, family therapy, individual psychotherapy. Great. Prognosis: over 60% of children participating with their parents in the CBT are successful in managing their symptoms without medication. SAD has poorer prognosis in environment where treat of physical harm or separation actually exist. Existence of other conditions such as autism decrease the likelihood decrease the likelihood of the positive prognosis. SAD in children may be associated with an increased risk of for the suicide. सो थैंक यू इट्स ऑल अबाउट दी सेपरेशन एंजाइटी डिसऑर्डर सिंपलाइज में आपका ट्रीटमेंट इज दी कॉग्निटिव बिहेवियरल थेरेपी फैमिली थेरेपी प्ले थेरेपी bibliotherapy relaxation technique parenting counseling teachers training. All right, so symptoms of the separation anxiety disorder, this may is it the refusal to get school or other activities away from the home, excessive worry and panic, anticipating experience, separation from the loved one and home, separation from the mothers, right? Mother to parents. And physical symptoms, the headache, stomach and stomach ache, particularly in the persistent in anticipation, not wanting parent to be out of the sight, nightmares about the parents being gone or leaving. Got it? So it's all about separation anxiety disorder. I hope you got it, you know, you understood everything. If you have any doubt regarding this, you may ask. Thank you for watching this. Bye bye.